Good afternoon, and welcome to the Cincinnati USA Regional Chamber's Business Briefings. This series is an extension of our leadership programs to help you and your business navigate COVID-19. I'm Amy Thompson, the Senior Director of Leadership Programs, and I thank you all for joining us today. My hope is that you've reached out to the Chamber and used us as a resource during this time. We are dedicated to helping you all through a helpline, through daily email communication, and truly hope we can be there for you. Today's business briefing is focused on how businesses can responsibly return to work. You have joined this briefing in listen-only mode with your microphones muted. Questions for our experts can be submitted in the Q&A, and we do encourage you to please use that function so that we can have a good dialogue today. You can also use the chat function as we continue through our conversation. If there are additional resources that you have come across that you'd like to share with other listeners, feel free to use that to share with others that are on this call as well. We will cover as many of our questions as we can within the 1 hour. And if you have to cut out early, this will be available on our website tomorrow. So let's jump in and have some fun. We have a great team here with us today, and I'm truly excited about this conversation as I know it will tee up many of our businesses for a great return. So we're fortunate to have with us Megan Schaefer. She's the Vice President of Retail Operations from the Kroger Company. Megan, great to see you and thank you for being here. Also a pleasure to have Dr. Jeff Wells. He is both the President and co-founder of Our Health. Thank you, Doctor, for being with us as well today. And Brian Norris, registered nurse, as well as EVP of Population Health with Our Health. Brian, thank you as well. This should be a wonderful conversation and appreciate you taking the time. So Megan, we'd like to jump in and start with you, as we know that Kroger has certainly been at the front lines of this. If we think back just, a couple weeks ago, in the last 6 weeks, you probably have sold more toilet paper and eggs and hand sanitizer than ever before. And I know Kroger is literally pivoting and constantly evolving and innovating every day. So we really wanted to have you kind of walk us through what has been Kroger's experience and really how have you responded and what are some suggestions you have for our audience?
Great. Thank you, Amy, and thanks for having us. Really appreciate the time. It's been a really fun experience, actually, at the Kroger Company of how we can respond to our communities. When you think about it, this is what we're here for. This is our purpose, and we're driven to serve our communities and feed the human spirit. So if you want to go to the next slide, I have a couple of slides prepared to just kind of walk through what Kroger has done. And in general, we've had at the forefront of what we focused on is a blueprint that we put together, and it's at krogerblueprint.com. So on the next slide, you can see that we really focused all of our actions on dealing with our purpose-driven response, which is the safety of our associates and being there for our communities and our customers when they need it most. So whenever you think about how your business responds to this crisis, is really having your purpose defined, and then that will help you in all your interactions with your employees and your customers and your response. So I want to take us on a little bit of the journey, and I'm sure it's top of mind for you guys as well. But on the next slide, you can see really a timeline of what the pandemic has been. You know, January 29th is when the White House developed the COVID-19 task force, and February 29th was when the U.S. restricted travel to China, Italy, and South Korea. And really only about 8 weeks ago, March 9th, was when Governor DeWine declared the state of emergency. And here in Cincinnati, Dayton, Kroger Division, we reduced the hours then on March 14th. And so one of the ways that we really focused on is how do we make sure that our stores are safe for our customers and safe for our associates, so that when we're operating our business, we can have the store ready and we can also give our store associates time to rest, stock, and clean. So on the next slide, we put together just some information of how we've been promoting healthy customer habits as well. And so when you think about how your business responds, especially in the retail setting, if you can figure out how you can communicate with your customers. So for example, we have in-store audio. How do we remind our customers to cover their mouth when they're coughing, to not come to the store if they're sick, to wash their hands, to stay separate from each other, the 6 feet away? That's something that we've tried to utilize our assets, and that's something that businesses can figure out how can communicate and promote those customer healthy habits. We've also ensured that we have additional breaks for our employees to wash their hands, and we've set up rotations in our high touch areas of where our employees can be given time every 20 minutes to really go wash their hands and sanitize their stations. We've also modified our return policy, so we're not accepting returns at this time. And then we've implemented our touchless Kroger Pay. And so if there's any way that your businesses can have the transactions without cash, it's very helpful.
Megan, I'd love to jump in, and these are certainly things that people will be really thinking about. How do they create? This is a great visual right here. Literally, you need to create the spacing. You need to think about ways you can minimize the contact as through the payments, really looking at the whole process. Love to also have you talk us through, I know people will be really thinking about the communication. How do we get the word out there to keep people safe, to both our employees, to our vendors, to our customers? What are some things that you've done, especially as we think about reaching out to those high-risk populations that may be engaging with our workplaces? What are some things that you've implemented, and how are you communicating that with your stakeholders?
Sure. So one of the first things that we started implementing in late March was senior hours. And so we reached out to all of our customers via digitally through our email and loyalty system, as well as posted signage that let our customers know that we had senior hours from 7 to 8 a.m. Monday through Thursday in the Cincinnati region. As well as for high-risk individuals. So one of the things we made sure of was to put it at all entrances. We also wanted to make sure that our customers knew that if they were feeling sick, we really wanted them to use other options to shop our stores digitally and not come to our stores, because that was putting our employees as well as the other individuals in the store at risk. So we do have these stop if you're sick signs at our entrances as well. In several states across the country, we do have one-way aisles in our tighter stores to really promote, the social distancing, as well as just communicating to our vendors as well, our partners, that this is a one-way aisle. All of these signs are available on the KrogerBlueprint.com if you'd like to use them or borrow them for communicating to your customers. As we go to the next slide too, you think about how do you communicate and encourage physical distancing while having a great customer experience. So we have used plexiglass screens to distance the cashier from the customer and the customer from the cashier at those high touch areas. And you can see the visual here, and we're happy to give any feedback to any of the businesses if they'd like more information. And one of the other things that we've done is we've really discontinued our in-store sampling, any of our service areas that had food out, and we really adopted these capacity limits through our QVision technology, where we're monitoring the amount of customers in our store that flags us before we would get to anywhere near capacity, so we could start doing a one in, one out. That allowed our customers not to have to wait in a line outside, but also gave visibility to our store personnel about how many people are in the store. So however you could use technology to help you ensure that physical distancing, we would recommend. And then on the next slide, you can see that we really focused on enhanced cleaning procedures that we've given to all of our staff and our leaders, and educated all of our employees on what we had in place. Another thing that would be great for the businesses to do is to procure third-party cleaning partners. You may not need them right now, but in the event that you would, it's good to have a contract set up or a phone call away that that they'd be there in order to help. And the other piece of what we've done is really partnered with our vendors. So on the next slide, you can see that we've actually engaged with our CPG and vendor partners, and we've suspended visitors, business travel, and any non-employee truck drivers in our division offices and our corporate offices. And we really encourage work from home whenever possible, and the contactless deliveries. So we actually expanded all of our vendor partners to be able to come overnight, so they weren't engaged at the customer time when they were in the store. So look for ways to adapt your operational hours and what can be done when customers aren't in the store, so that you can limit that and promote physical distancing. And in general, we've asked all of our vendors to wear PPE as well. And then the final thing that I really want to talk through is really how do you take the digital world the next level up, because customers are engaging, and how do we provide that for our customers at a lower price or reduced fee. And so we've done that in the Cincinnati region, as well as trained our employees to say, we'll drop it off in your trunk. If you don't want us to engage at the window, we don't need to. And then one of the things that we did do is have a pickup only location to serve right around 1,200 customers a day if needed. So that is another way, is how do you, if you have multiple branches, have one that's solely focused on that contactless option.
That's great. And Megan, I do want to remind our audience and group that's listening that as you're mentioning things and as we continue this conversation, we do have the Q&A function, and we would absolutely love for you all to use that as we're going through. If you have questions or want to dig in further on any of these areas so we can help you prepare, we're happy to do so. I know that top of mind is not only the business procedures and making a number of adjustments around sanitation, but really, how do we take care of our employees, right? This often comes down to people. So would love for you to walk us through, this has certainly been an evolution over the last 6 or so weeks as you've really looked at how do we best take care of our employees. Walk us through, what are some of those processes that you have implemented? What are some recommendations you have that businesses should be thinking about?
Sure, thanks. I think one of the biggest things is being able to be flexible. So, I'm sure that all of us on March 9th, we're not thinking we'd be where we are today. And so that's something that it's an evolution. And as leaders, we really connected on a daily basis and had huddles on a daily basis in retail operations of what should we be thinking of next and how can we further progress promoting these healthy employee habits. And so one of the things that we learned was most important, especially being a retailer that employs 450,000 people across the nation, is we need to make sure that that information gets directly to the associate. And so how do we do that? So we've, pulled out some old goodies like posting signage on the time clocks, but we've also leveraged our external messaging through Facebook, through, different newspapers and those types of things. So just make sure that you leverage all the assets you have to communicate with your employees so that you can get down all the way to that part-time employee that's focused on what the company is doing for them, but also what they can do for themselves on a daily basis. So as you go into the next slide, we've posted these everywhere, but we have an associate alert system that they can get alert types about the pandemic. They can call, and it's a simple old phone tree system that I'm sure many companies have. We've ensured that we post the sign on the right in every single time clock in every single restroom, and really encourage the wearing of masks and gloves whenever possible. And so I think it's one of the things that we've talked a lot about is that we're not satisfied until every associate knows those 4 things on the right of what they're supposed to be doing. So when you go into the next slide here,
Megan,
just really wanted
go on, if you don't mind, I'd love to jump in because we're getting, and it actually relates to this next slide as well. We're getting some questions that are coming in. One of the questions is around your policy, or really around the masks. And I know we've seen pictures of people wearing masks, but maybe you go to pick up your groceries and someone is wearing one and someone is not. What is Kroger's policy? Is it encouraged? Is it required? Will it be required?
Sure. So actually, as of Sunday, we required them, all of our associates, to wear when in stores and distribution centers. I'm at the office. I'm the only person on the floor, so I'm actually not wearing a mask today. But if I am in stores, I am wearing a mask. And so we do require that. We have multiple options available for our associates. So we have reusable masks that are the cloth type, as well as the disposable paper masks. And so what we've done is ask all of our associates to wear them and really focused on the reason why. It's not just for the employee who's wearing it, but it's for the employees that are with them in the store, and then also everyone across our customer base. But we did just start requiring them as of Sunday.
Wonderful. Okay. Thank you so much.
Mm-hmm. Yeah. And then one of the things too is you I don't know if you guys have been wearing masks, but they are a little constrictive sometimes. And so we have been looking at other options for associates that may have health reasons why they can't wear a mask on their face, such as face shields and other things like that. So we do have information to share on those types of options if anyone is interested. But one of the main things that we've also shared is how to take care of masks. And we've worked with Dr. Mark Watkins, our Chief Medical Officer, on how to handle the proper use of masks and gloves. And then one of the other things that we've done on the next slide is in several of the hotspot areas, we've actually encouraged and are requiring taking of temperatures of our associates. So that's one of the things that we have done is given temperature monitoring checks, and we've encouraged our associates to stay at home. If they need to stay at home because of a possible exposure or those types of things, we have extended our leave and adjusted our payments for our associates. So there is a 14-day guaranteed pay leave. And we really encourage mental health needs. We've had our partners and our health partners reach out via mail as well as email to our associates to encourage mental health.
Megan, I do want to jump in on that. Mental health is so important, and there are a couple questions coming in. This is an environment, unfortunately, of fear. And how have you dealt with employees who are afraid to come to work because they are fearful of COVID-19? How are you handling that?
Sure. So we are ensuring that we're talking with the associates and allowing them to have visibility to the managers. We're providing the PPE to them. We've also asked if they would like to engage in roles that aren't front facing. So for example, if an associate is uncomfortable on the front end, would they be comfortable doing the night crew and stocking groceries at night in an aisle by themselves? So we've been trying to adapt where there is concern. And then we've also focused on having discussions if someone's feeling sick, that they stay at home. And we have increased all of those leaves and those options to the employees as well. And that was in March. And then another thing that we really have highlighted to the crew, and our communities have helped us with this, is that they are the frontline heroes. I know we're not in the medical field, and I know we're not first responders, but we were really happy that the government and FEMA leaned in to give face masks to grocery workers and those types of things, because we are serving our communities. So it has been a sense of pride for our associates, and you've seen that in some of the employees as well.
Megan, you're absolutely right. You really are serving a need, and it is so critical. And one of the questions is, have you increased your wage? Have you increased the wages for the lowest paid employees to really encourage attendance? And we also know you've been hiring through this. So tell us a little bit about that as well.
Yeah. Sure. So we actually gave a hero bonus to all of our employees. So $300 in March, a one-time bonus, and then for our full-time workers, as well as a $150 bonus to our part-time workers. And then beginning in April, we have given a $2 hero bonus per hour work, and that's been through May 2nd that's happening. So we have tried to say thank you to our employees and reward them for coming in. And then in addition, you know, with the surge in business and the change of the bars and restaurants not being open, our business has obviously increased. And so we have increased our pickup business drastically. And so we're hiring a lot of new people to aid in that digital need that before we didn't have that same digital need. And so we have hired between 50 and 60,000 associates across the United States in the past 8 weeks.
That's incredible when you think about those numbers and trying to onboard and train very quickly and get people up to speed on your typical policies and procedures, but your safety policies and procedures. That I bet you all are working some long hours, and we thank you.
Yes, but it's definitely fun.
Yes, there are a couple
because and the reason, sure.
Oh, go ahead. Go ahead.
I was just going to say, I think it's been such a motivating experience for our communities, and we've been seeing things across the United States of people being grateful to us. And I can tell you our mission is to feed the human spirit. And so really, we felt that from our associates and from our new employees as well. So you said there were some questions.
There are, but I love it, just pausing for a moment to go back to your mission of feeding the human spirit. That is really powerful right now on lots of levels. This is just an important time to really feed each other. And one of the questions that's coming in is let's stay with the employees for a moment. Of how are you handling employees who are over the age of 65 or may otherwise be in a high risk category?
So on that, it's being handled individually. I can get the specifics. I know that there's some information on the KrogerBlueprint.com, but it is being handled on a case-by-case basis through our HR teams.
Great. And speaking of HR, a couple other questions that certainly would impact your HR team. And it's really about the employee health and well-being. So talk us through your process of taking temperatures. Are you having them take their own temperatures? Is there a process? Are they reporting that? And if you can also speak to, as you've looked at, are there any legal concerns or implications of having employees taking their temperatures as well?
Sure. So we are requiring where local governments have asked us to. So in Dallas County and some counties up in Michigan. So we are requiring that when needed. We are not recording temperatures and we will not record temperatures. And so basically if an employee goes above 100.4, then we are sending them home. And then the 14-day leave that they would be able to go on is then goes into effect. And so then we reach out to our HR teams and they coordinate there.
Wonderful. Thank you so much, Megan. And I know we will certainly have additional questions. So for our audience, please continue sending those in. I want to bring a couple of our other panelists in here with us for this conversation. So again, thank you, Megan. This is great background, and we will certainly have all of us back on screen in a moment. But I'd love to really bring on Jeff and Brian with Our Health. I know that you all are focused on employee wellness, and as you can tell, this is a hot topic, right? What are we doing to take care of the employees during this time? But Jeff, before we jump in, there are probably people that are not as familiar with Our Health and would love for you to just talk us through what is Our Health, what are you doing, and what is some of the context in terms of what you're seeing as to our current state?
Yeah, thanks, Amy. Maybe I'd just start by acknowledging, how appreciative and grateful we are as an organization and just as individuals to, Amy and the broader, to Megan and the broader, Kroger company. I happen to be based in Indianapolis. We obviously do work really throughout the country, but in the greater Cincinnati region. But we have Kroger stores here that I frequently shop and have really been impressed with all the activities. So, thanks to her. In terms of just who we are, maybe if you flip to the next slide, Our Health, who recently partnered with another independent primary care group, Marathon Health, are essentially an advanced primary care group that serves employers across the U.S., in particular self-insured employers, with a model of trying to provide patient-centered kind of population health management. So we do a lot of wellness, really proactive engagement to help individuals, broadly speaking, from a primary care and wellness point of view, to improve outcomes and then help lower cost. And then just really quickly, to give you a sense for our organization, we currently have 1,000 team members operating in 42 states. We work with about 130 or so employers in various industries of various different geographies kind of throughout the US. And obviously are an essential business as well. So we've been operating, providing patient care as a primary care provider, really since the late February, early March timeframe to the present, and happy to kind of talk both in terms of how we've approached this as an employer with both office workers and then our frontline staff, as well as on behalf of a lot of the employers that we work with. And so then maybe very briefly would just kind of highlight, sort of to the present, what we know today. I think at this point, these things are pretty obvious, but COVID-19 is highly contagious. And as we all know, there's not a cure or treatment. And, physical distancing, as, Megan really hit on from their perspective, continues to be sort of the most important area of focus across, all organizations and really society at large. But as we, are beginning to have conversations about really emerging from this and sort of responsibly, returning to work, returning to more broad operations, returning in a responsible way to more civic life, how do we do that in a really thoughtful way? So just maybe thinking about, as an employer, how we've operated, similar to, Megan, we have instituted a number of different approaches to try to minimize physical proximity among not only our own healthcare teams, but also patients where it wasn't necessary. And so in mid-March, we shifted to moving from a historical posture where we would see 90% or more of all the patients that our healthcare teams would see in person in the physical health center over about a 10-day period, transitioning to about 85 or 90% of all those encounters done remotely, so through telephone or video means. We also have an internal team with an occupational health nurse practitioner, our HR teams and operational leadership that essentially formed a task force and had very clear protocols and policies to protect the safety and health of our own team members. And so whether that's protective equipment, changes in policies and approaches, as well as protocols for those that have symptoms or known positive exposures. And so as we think about where do we go from here, kind of just highlighting what we expect the weeks to come to look like. It reminds me of a crisis management lesson that I learned really in residency training as a primary care provider, working with a critical care and kind of emergency physician, which is sort of in the midst of a lot of uncertainty and a crisis, whereas normally people say, don't just stand there, do something. The advice was, don't just do something, stand there. And I think the lesson wasn't so much like, don't act. And it wasn't literally don't do anything, but to really be thoughtful and use judgment in terms of how we move forward. And so, all the things that Megan outlined for their organization, I think obviously been done with a lot of thought. I believe what we're seeing is as many more businesses and more organizations start to resume aspects of life, it's just critical for everyone to understand we're not going to go back to quote unquote normal, like we're not going to go back to what things were like at the end of January in the immediate future. Some might argue, some things may not go back ever, but certainly for many, many months, we're going to have to adapt in all facets of life and in business. And I think that's an important acknowledgement. And there's also a disconnect, I think, in sort of just generally speaking, the media today with the availability of things like testing and, treatments and so forth. There's a lot of questions that generates and misinformation. And so I think, sort of we're trying to take a view or a posture of being very, very thoughtful and rational in terms of what a strategy would look like to sort of reemerge. And if you just flip to the next slide, we've recognized that there's no silver bullet. There's no one single action that's going to materially keep, our employees or teams safer or the constituents or customers that we serve. So it's going to be kind of a framework or a multitude of things. And candidly, it's really going to vary. Like the details are going to vary based upon industry, the type of organization that you are. Do you serve the general public, or are you more of a B2B kind of enterprise organization? You know, sort of where you are geographically. And so this audience certainly is going to be concentrated in the greater Cincinnati region. But you know, every different community, and for those that might have regional or national workforces, things are just going to be different, and it will necessarily require potentially different solutions to the problem. High level, we think that this framework has sort of 4 key areas of focus for any organization that's either been operating and looking to continue to sort of improve upon their approach, or particularly for those that over the coming weeks or month will begin to get back to work. The first is this kind of concept of workforce planning. I think of it as almost policy development and sort of creating a strategic approach. And that would include making sure you have cross-functional leadership. And so thinking through, HR policies and, sort of the approach for the team. Some of the questions earlier about fear and uncertainty, thinking about employee psychology and being really focused on employee engagement and communications, legal and risk management, sort of having a seat at the table. Depending on your organization, if you have clinical leadership with a chief medical officer, a medical director, if you have third parties that you could work with that can bring some clinical input would be helpful, facilities management and so forth, kind of being part of just creating a roadmap, if you will, a set of policies. Secondly would be the concept of the physical environment. And so again, Kroger shared some really, really good best practices. Every different type of organization may need to think about this differently, but the concept of doing sort of an audit or intake to your physical plant or your facilities management. Are you serving guests or external constituencies? Can you control access points? All different types of approaches around the physical distancing. And that might take into account things like obviously continuing to work from home where that is feasible and appropriate, considering adjusting shifts or team design to reduce the density of individuals working in close proximity where feasible, considering the idea of pods where you might have fewer individuals in close proximity working so that if one person does become positive or infected, it sort of reduces the number of those that are exposed from kind of a business continuity perspective. And then, thinking about sort of other workplace precautions that we touched on just earlier, whether that's obviously hand hygiene, hand washing, masks from a source control perspective and otherwise. I won't go into as much detail, and I'll let Brian from our team touch on sort of the active monitoring around testing and screening, which we kind of heard about, and how that is going to apply differently to different organizations where there's some nuance that really needs to be thought through to incorporate things like testing or the temperature or symptom screens. And then long-term prevention and sustainability with the use of vaccines and treatments. I would just say today, as we all know, there's not a vaccine, there's not a way to prevent COVID-19. There's also for those that are outside of the hospital, there is currently no known medical treatment that treats COVID-19. For those that are severely ill and hospitalized, there are a number of drugs in kind of experimental use in early clinical trials, some of which have some data that suggests they're really more harmful than helpful, and others that might have very early indications, but potentially more positive benefits. None of those apply to people outside of the hospital currently. So with that, I might kind of take additional questions. Oh, go ahead.
I'd actually love to jump in. There have been some questions around, I'd like to go back to the space. That is certainly top of mind for a lot of business leaders of how do we navigate elevators, stairwells, the physical desks, the lunchroom. We're hearing some suggestions of you designate some stairwells are up and the others are you're going down, or what type of things are you recommending or seeing that people are doing well?
Yeah. So a few sort of data points to maybe help inform thinking through questions like this. The first would be, again, the virus is highly contagious. And so that's sort of the reason for all of the recent response over the last 6 to 8 weeks. And although we don't have enough information based on testing today with exactly how many people have been infected broadly across the US or even in the greater Cincinnati region, there's more people we know that have likely been infected than there are that have had tests, just due to a disconnect between the capacity and the amount of test available. And so therefore, we don't really know exactly how many people have been infected and how close society might be to this concept of herd immunity. Mm-hmm. Our best sense, and this is only kind of intuition and the nuggets of different data points, is it's almost certainly, we would think, less than 10% of the population that's been infected, and maybe even less than 5%. It likely varies by community, so it's not standard across the US. And therefore, this concept of physical separation or physical distancing continues to be really important. And so all the questions you asked about kind of, elevator space and so forth. Actually, one more data point. And again, it's not certain. We do know that the virus is transmitted through respiratory droplets. As best we can tell, that's, basically someone sneezes or coughs, those droplets hang in the air, and if you're in close proximity, could be inhaled, or if you cough onto a surface or doorknob, countertop surface, a coffee mug, hand railing, and then someone else were to touch that and then touch their eyes, nose, mouth. That's how it's transferred. The evidence so far does not show that it's aerosolized, so it doesn't truly, you can't just pass it through the air per se, but the droplets do stay suspended in air for a period of time. In lab experiments, the virus can remain on hard surfaces for an extended period of time. I don't know that we perfectly understand how long it can stay on surfaces and still be truly infectious to others. So I think the current advice would be err on the side of caution. So yeah, all the things that you've suggested, if you can adjust workflow design, so you have one way in, one way out, and reduce cross traffic, really good environmental cleaning practices on common surfaces, really moving away from community use things like the water cooler, coffee mug type thing. Anything that's going to bring people together to touch or use the same surface, we would want to discourage.
Great. Jeff, thank you. That's helpful. And as a matter of fact, a number of questions are now coming in that I think will be very relevant for Brian. Brian, I'd love to have you jump on. You're really focused on population health. Tell us a little bit about testing, active monitoring, screening procedures, just kind of contact tracing. Walk us through some of those things that we should be thinking about.
Sure, thank you. So, you've kind of heard probably in a number of ways, the way to kind of look at combating this is, test, trace, and treat. I guess I'll start with sort of a testing front. There really are two kinds of testing. One is what's called PCR testing, which is looking for active infection. And the other is antibody testing, which we've heard a lot about. Mm-hmm. I'll start with the first. So what we've learned and the science is starting to evolve over time is that COVID-19 can be and is transmitted in asymptomatic individuals. So people who do not express symptoms of any sort of sickness or illness. And the science is starting to coalesce around potentially 2 days prior to developing symptoms. An individual may be shedding virus or the most contagious, if you will. And so PCR testing is one way to look for active infection of COVID-19. The other is serology testing. Otherwise, probably you hear it in different ways. It's either serology or antibody testing. It really looks for two different antibodies, IgG and IgM. And really what that's looking for is answering the question, who might have already had COVID-19? So typically you won't develop antibodies to the infection until somewhere north of 7 days post-infection. And today the science is a little inconclusive as to answering the question of, if I do have those antibodies, am I actually immune or have developed some level of immunity towards COVID-19? It's unknown as to what level of antibodies and for how long that immunity might last. So those are kind of the two types of testing. We're seeing vendors come out or new modes of doing the PCR testing every single day. So the most common mode is what's called as nasopharyngeal testing, which you swab kind of back to the ear, and that swab is sent in and looks for, active infection. We are seeing, different labs come out with additional types of testing that are all being regulated under the FDA emergency use authorization. So they are not FDA approved, but they're approved in sort of emergency use cases. So what that means is that they've demonstrated some evidence, but that evidence could be on, very small populations. New modes that we're kind of excited to look at would be just simple nasal swabs, as well as spit tests. And so, we're starting to see that space rapidly evolve. On the antibody testing front, the key challenge there is that, many of the ones that have come through, and there's only been 6 total that have been approved as of yesterday through that FDA process, is false positive rates. So there seems to be a high degree of what's called a false positive rate, which may be related to, coronaviruses have been around for a long time. And these tests may be picking up prior infections of other coronavirus strains. It may give a false sense of security to an employee or an employer that an individual has developed some immunity or has had prior COVID-19 infection. So that's on the testing front. On the screening front, we are seeing, Megan and her team have done a really great job at Kroger. I too frequent Kroger. And I think they've done a really good job at sort of demonstrating, what we're seeing out in the market on screening. It's, first and foremost, the biggest thing you can do is socially distance and not spread the infection, and make sure that employees feel comfortable not coming to work sick, and that they feel heard. The second thing you can do is sort of help them understand what are the key questions to ask. So the symptomology of COVID-19 is evolving. The FDA or the CDC just updated their website yesterday with additional symptoms criteria that you can meet for COVID-19. So helping employees understand, what are those potential symptoms of COVID-19 and what to look for, and when to raise their hand and reach out to a primary care provider to further assess. Temperature checks, fever certainly is a symptom of COVID-19. There have been various different studies that have shown prevalence of fever, but there also have been additional studies that have come out recently. One out of New York that showed, 30% of those that presented at triage to the hospital that were on hospitalized patients had a fever. The rest were afebrile. And so, fever is one way of looking for sort of that active infection and helping make sure that, those that are sick kind of stay home or go home. But it certainly isn't the only line of defense in sort of the screening and the screening component. And then, if you have an employee that's either tested positive for COVID-19, there's this concept of contact tracing. And this is an area that the local public health departments, the state and the national public health departments are investing in heavily to build up the resources. And what this means is that, we got to do a really good job at isolating any potential contacts that may have been with me if I were infected with COVID-19 that potentially could have also gotten infected from me. And so when a positive is identified, being able to trace that back is really important. And what that means from an employer standpoint is that making sure that you can identify, let's say you're in a manufacturing line or manufacturing facility, who might have been around me during the prior couple of days before I became symptomatic, and further into that I might need to assess or have assessed for potential infection of COVID-19. Certainly the public health departments do a much deeper dive on that. They assess, where have I been, how many people have I been in contact with, but contact tracing is really important aspect of this as well.
Ryan, I'd love to jump in. There are some questions. Peter is asking a couple questions that are coming here around, let's say someone is COVID-19 infected, and what is the role of the employer to contact the local public health? What's their role versus the individual's role? And then secondly, can you also talk about what's it look like on the front end, right? That reporting piece, but then also on the back end, when can they return? What does it look like for that person to return back to work as well?
Sure, great question. And I'll have Jeff jump in on anything I may not have covered. So the first part is, if an individual tests positive for COVID-19, they've had a test, and the labs that are conducting that test are typically required to report that as part of a state or public health department syndromic surveillance to the public health department. And then that public health department begins the act of contacting that individual and the contact tracing that I mentioned. From a patient standpoint, as they test positive, making sure that they're following their HR procedures and notifying their HR department, and making sure that they're aware, and then following those procedures. From a return to work, typically what we see, and the CDC guidance has changed a little bit, but it stayed pretty steady, is that you typically want to see somebody who's been infected by COVID-19 be asymptomatic for up to 7 days, right? No fever, no signs or symptoms. And then what we're seeing happen is sort of post-testing to make sure that they're not carrying active infection. And so we've seen protocols that range from a negative PCR test to, in some cases, 2 negative PCR tests 24 hours apart before returning to work. But really around the symptomology is the biggest one we've seen, is making sure that they're asymptomatic for a period of time.
Thank you. That's very helpful. I would like to pull all of us back onto the panel and bring Megan back, as we have a couple of questions that really are relevant for all of us. And let me just start with training resources. That's been a question that's come in. Love to hear from all of you. What is Kroger doing around? Are there training resources that are available that you have on the website, Megan, that are available to share? And then Jeff and Brian would certainly love to hear from you all as well on any training resources you recommend right now. Megan, what's Kroger doing there? And you may be on mute, my friend. There you go.
Okay, sorry about that. From a safety perspective, we have training resources that should be on KrogerBlueprint.com, how to put on a mask, how to put on gloves, steps to do that safely, that our legal teams and also our Dr. Mark Watkins developed for us. So that's some of the things that we have available on the KrogerBlueprint.com. We're also ensuring that there's videos, and we have an internal communications called Feed. And so we've made sure that everyone can go on that. They can access it through their phone. They can access it through their computer. Our hourly team members can access it through the computer at the store. So those are some of the things that we're doing. We also have a Yodel page that is our version of kind of like an instant messaging that they can use on their phone as well, that has all that training material available. So that's one of the things, how can you post it on Facebook or those types of things and leverage your communication and your external communication with these documents. But we do have all of it available on KrogerBlueprint.com.
Great, thank you. That's very helpful. Jeff and Brian, what other training resources or things have you seen that either you all have, or certainly companies you've worked with that you've seen?
Happy to respond to that. I think there's a number of just publicly available, online kind of employer guides as a decent starting point if you're starting from scratch. And the CDC actually is a really good reference. And they have on the CDC, if you just Google, CDC COVID-19, it's very easy to navigate to. And there is a specific section intended for employers. There are other OSHA and some of the other kind of national, governing bodies and so forth would be good. Obviously, Megan and some other large employers have been public with really good comprehensive plans, and you can find those. I would say from, a few other things I would just add as an employer, again, about 65 or 70% of our team are frontline healthcare workers. So what we've been doing since really the beginning of March, we have a task force internally that we've created. There is a very succinct kind of daily update that goes out from a communication point of view, because we candidly are adjusting and changing policies, procedures, really on a daily basis. And so there's a very succinct daily thing. We have an intranet site that we post updates for our team. And then we've even done a sort of a higher touch engagement, kind of going back, and this may not apply to every organization, but to the psychology and just level of employee engagement and reassurance. We have our clinical leadership do a call with all of our clinical staff. It's voluntary, but almost everyone joins twice a week for a touch point. And that there's a lot of information that can be distributed, not just for reassurance, but policy and protocol development that sort of goes through that. So just a few additional things that we're doing that we've found helpful.
Great, thank you. Beyond training, I know that another area that people are worried about is certainly some of the privacy and the legal implications. 2 months ago, maybe 6 months ago, we certainly would not be at work asking about each other's health. So I would love, and I don't believe anyone here on the call is a lawyer, but a question's coming in when we talk about the contact tracing and HIPAA, that it sounds incompatible. So what really is legal? What is appropriate for employers right now to be asking and really following up on some of that? This is a fine line as we think about HIPAA. Brian, do you mind talking about that more?
Yeah, I can jump in. The question of can I take somebody's temperature and sort of report it, it probably is a good example of this. There's been a sort of a point of view that has come out from the government that said, that is fine to do sort of under this pandemic rules. Sort of normal every day prior to pandemic, that might have been a different case, but during pandemic rules, there are some options for additional information to flow to employers. I think privacy and security of that information is really important. So kind of back to what, some of the things that are simple, access points and making sure that you're not curating queuing and choke points if you are doing screenings is really important to protect privacy. Staggering shifts to make sure you don't have massive amounts of employees coming on and sort of sharing private information is super important. And then one of the things we've done for not only our own employees, but all of our patients is, we identified those higher risk individuals that might have further complications for COVID and reached out to them. And if to the extent that employees are willing to share that, they may have diabetes or they may have some cardiovascular complications or those types of things, giving them that opportunity to share that and then have an open dialogue about their work situation and what would make them comfortable, as Megan said earlier, is really, really important.
Great, thank you. I have two tactical questions and then want to close with a question that has us thinking about the future. The two questions that are very tactical are, one is, what are some best practices with gloves and wearing gloves? What if you're wearing them all day? Doesn't that get sort of nasty? Andy, I appreciate this question. I'd love to know the answers on that. Should people be shifting into different gloves? What are best practices? And then the second one, and I apologize, I missed this term as well, there was a question around what does the term shift flighting mean?
Yeah, I'd be happy to take the shift flighting. I can weigh in on both, but I'm certainly not an expert on on the glove question. On shift flighting, that concept is really, I sort of interchangeably maybe use that with the concept of pods, right? So you want to reduce maybe the number of people that are working together on a given shift or on a given team, and potentially keep them flighted, if you will, like on the same shift, daily, as opposed to intermixing or intermingling teams. The rationale for that is if someone does ultimately develop COVID-19, you want to minimize the number of people they might have exposed. And again, that will vary by the type of work that the organization does. And again, from my perspective, I am not really an expert to be able to weigh in on sort of the glove question. I think some of it depends on the context. So in a healthcare context where there's much more kind of, for lack of a better term, closer contact or more intimate contact with those that might be sick, we would definitely have protocols where people are not wearing the same set of gloves, interacting with patient after patient after patient. In a different context or scenario, if you have a restaurant worker or someone in retail, I think there's maybe a different conclusion that one draws depending on to what extent they're interacting and touching, surfaces or people that might be infected. And I honestly don't know how long a virus would stay on, sort of a a glove, depending on what material it is and so forth. So I'm sure someone knows the answer to that. I don't.
Great. Thank you. Megan, do you have guidelines that you all recommend there at Kroger around glove use?
So our guidelines are actually gloves can be used and should be used if an employee feels that it will make them feel safer, but they should be washing their hands frequently. So I think that's the biggest thing, is that setting up times that they can go take a break and wash their hands. That's the most important thing. And then also having hand sanitizer. We have been coaching our associates to know that just because you have gloves on, you still shouldn't touch your face. And so those are the types of things that there is no, I think, perfect answer to this, but understanding what the glove is doing, it's trying to protect the associate, but then making the associate know you can't touch your face and you should still be washing your hands. So if someone takes them off, we do give guidance that they should not put them back on. So, and they should get a new. That's our general guidance too, is that if it's taken off, they should not reuse it.
Great, thank you, much appreciated. So final question for you all. This is coming in from Mark, a great question. We are learning a great deal during this time. As you think about your own businesses, what are some things you're learning now that you will continue to implement? What are some new practices or innovations that will carry beyond when COVID-19 is over?
Sure, I can go first, and then Jeff and Brian can go. From a retail perspective, it's evolving every day, and things that we did 4 months ago with open air salad bars and those types of things, we're looking at what is the future for us. But as it relates to employees, I think the focus on employee safety is the right one, and continuing that for the future and having that as your top priority. While all of us as businesses had it as a priority, including that as our top priority, I think will be something that's been a big learn for us through this crisis. And then also, I think it changes by the day and food preferences change. So it'll be interesting to see what happens to certain industries, certain types of products, and what stays with us and what goes away. So we're learning, and it's too early to tell.
Great, thank you, Megan. I tell you, I hear time and time again, if you make your employees first, ultimately your customers end up first, because they are taking care of your customers. And I love that learning. And if businesses can continue to really focus on employee health and how we really create wonderful, strong teams, that's a fantastic outcome. So thank you, Megan. Jeff, Brian.
Yeah, just really building upon that, I think of kind of the concept of resiliency or adaptability. And for our organization, by necessity, in a matter of, like I said, maybe 10 days, we shifted a meaningful part of our clinical operating model from one that historically was driven almost 90% in person, which we highly value. I think a primary care, personalized, kind of intimate, healthcare experience is, in our view, almost necessarily needs to be done in person, between a healthcare provider and that patient. But by necessity, we were forced to shift kind of how we think about all that and how best to support it. In now 90% of those encounters are, like I said, remote, virtual video or telephonic. In the long term, I don't think the right answer is that 90% should be sort of digital virtual encounters, but I think there will be a really durable maintenance of virtual healthcare delivery as part of our primary care approach. And the biggest takeaway for me that I think will stay with our organization is sort of that resiliency, or like the change management. Under normal circumstances, this kind of a shift would have candidly would have taken our organization 12 months with a ton of people pushing back, saying, look, we can't do this. There's too much risk. It won't work. And everyone, almost to a T, just jumped in and said, this is absolutely what we have to do. We'll go figure it out. I'm on board. You've got buy-in. And that level of just engagement and camaraderie and, adaptability, I think is sort of culturally something that our organization can build upon for years to come.
Great. Thank you. I would absolutely agree. A crisis is certainly an opportunity to bring people together around a cause and to really allow for some new ways of doing business and new ways of thinking. Brian, any final closing thoughts?
Yeah, I just think I'll add to Jeff and just say, we learned a lot. We had a good foundation for outreach to our patients, but, as I mentioned earlier, in the span of about 3 weeks or so, we called just about every one of our adult patients to just check in and make sure that they're okay. And we started with those that were most at risk and worked our way down. And so, that type of a process is pretty powerful if you think of some of the other use cases. So I don't see that going away.
Absolutely. That communication and the outreach is critical. Well, Brian and Jeff and Megan, truly a heartfelt thank you for joining us and spending time with us today. I know you're gracious with your time, not only now, but for the audience to certainly follow up as well. So reach out to learn more at ourhealth.org to stay connected and certainly learn more. And thank you again to Our Health for being a part of today. Kroger, great resources there with the blueprint, and certainly you can ask your questions there at that email as well. So thank you all. What a wonderful session, and really helps us think about how we can get back to business. Speaking of, we continue to provide different educational opportunities for all of our members. We will be targeting the manufacturing sector tomorrow with an interactive roundtable where people will have a chance to share best practices and answer questions and connect with one another. We certainly hope, if that applies to you, that you can be with us tomorrow at 9:30. As we close out today, we are here truly for our members today and into the future. And if you're not a current member, we highly encourage you think about membership. We, as the Chamber, are dedicated to helping you not only in COVID-19, but certainly way into the future. So from all of us at the Cincinnati USA Regional Chamber, we want to say thank you, wish you and your family and your team members well. Stay safe, of course, respect that social distancing, even with those that you love. And as we sign off today, we're going to ask you to go wash your hands once again. Thank you so much. Thanks for being here.